Have you heard of physical therapy for Parkinson's symptoms? Or are you wondering if physical therapy is right for you because you're maybe not that bad yet? Or maybe your spouse is gently encouraging you to learn more about a Parkinson's physical therapist in your area? Well, today I want to walk through 3 indicators that let you know that you may be a great candidate for Parkinson's physical therapy. Before we hop into that though, I want to remind you that rehabilitation is only a small part of your Parkinson's plan of attack, which is why I've put together a free downloadable checklist that can help you get started on your holistic Parkinson's plan of attack that not only addresses rehabilitation and exercise, but also helps you with nutrition, mindset, stress management, and the whole shebang. So you can download that checklist on my website, and there's a link below this video in the description. Physical therapy has come so far in the last 30 years, and you may be used to a physical therapist that massages you a little bit, stretches you a little bit, and then puts a hot pack on you. Did you know that now there are physical therapists like myself who are specialized in helping people who have been diagnosed with Parkinson's, who have Parkinson's symptoms, rehab and actually get stronger, move better, and feel better, not just now, but for the long run? I know I may be biased, but it's a really awesome program because these therapists, and there are hundreds of them out there, if not thousands of Parkinson's specific physical therapists who can help you tailor an exercise program specifically to help you address your posture, your small movements or bradykinesia, rigidity, your balance issues, and they're really incredible and a great resource. I know you may be thinking, yeah, I have some of those symptoms, but I'm not that bad. Which brings me to my first indicator that you may need to see a Parkinson's physical therapist. Research suggests that an exercise program that's tailored specifically to Parkinson's symptoms is most effective when it's learned and implemented as close to the onset of Parkinson's symptoms as humanly possible. And unfortunately, what happens because people like yourself are not seeking out physical therapy early, or even physicians aren't referring people to physical therapy early, people end up waiting until balance issues become a real problem to seek out a physical therapist to help them improve. And really, they're missing out on so much valuable, potent time because the longer you wait to start exercising specifically for your Parkinson's symptoms, the less of an impact your exercise actually has. The second indicator that you may need to see a Parkinson's physical therapist is that you've had more than one fall in the last 3 months. Now, I know it may be really tempting to say, oh, I didn't really fall, I just kind of lost my balance and, it wasn't that bad. But really, if you are even just feeling wobbly and unsure and not confident in your walking, when you're out at the grocery store or you're walking on an uneven surface like gravel or grass, those are really important times to actually go out and see a physical therapist before balance really becomes an issue. And you really qualify for physical therapy for your Parkinson's if you've had more than 3 falls in the last 6 months. That means you're at a really high risk for having falls in the future, and your physical therapist can come in, figure out why you're having issues with your balance, and really strategize on how to tailor an exercise program to make sure that you're more steady on your feet and you stay off the floor for as long as humanly possible. Another thing to be aware of in the falls arena is this fact that Parkinson's clients can often have a symptom called freezing, which is when your bottom gets stuck to the chair and you can't really move, or your feet get stuck to the floor and you can't really move. It's this trouble initiating movement or changing directions, maybe turning quickly, your feet get stuck, or you get hung up. That is called freezing, and you can see a Parkinson's physical therapist who can do what's called a freezing intensive with you to really strategize and rewire your brain so that you can not only identify how to avoid getting stuck in the first place, but help you problem solve when you do get stuck in the community so that you don't end up on the ground. The third indicator that you might need to see a Parkinson's physical therapist is that you've had a decline in function. Now, decline in function is just a fancy way to say that you have noticed you've gotten weaker, slower, or really just haven't been feeling good for the last 3 to 6 months. And this might be because of an injury, because of an illness, because of just a really stressful environment. Things happen in life. And I want to tell you not to just say that this is Parkinson's progressing, because that's not true. You don't have to just chalk it up and say, it just means that my Parkinson's is advancing and getting worse. No, Parkinson's advances because of inactivity. Sitting still and not doing anything is pro-degenerative, which means that the longer you sit still, the worse your symptoms are going to get. And so don't fall into this cycle of thinking, I'm getting worse and I can't do very much, so I'm gonna restrict how much I actually do, and then you're moving less and less, and you see how that cycle continues. So I wanna just be the one to tell you that if you have noticed some type of decline in your function and you haven't seen a Parkinson's physical therapist in the last 6 months, to please seek one out, because you don't have to get better, or you don't have to get worse, you can actually get better. All right, so those are the 3 indicators that you may need to see a Parkinson's physical therapist. Thank you so much for watching. I would love to know what your experience has been seeing a Parkinson's physical therapist. Was it great? Was it terrible? Have you never been? Are you worried about going? Write them all down and share with me in the comment section below. I would love to hear from you. And while you're down there, make sure to give this video a big thumbs up if you enjoyed it, and share it with anyone that you think may benefit from seeing a Parkinson's physical therapist. I really, really do appreciate all of those shares. So until I see you next time, keep moving, and I'm sending you lots and lots of big hugs. Bye.